skiing and you need a knee replacement, we're going to be putting in a knee that has a biofilm with CBD that's going to be released over a long period of time, which encourages wound healing, which encourages anti-inflammation and pain treatment. So orthopedics is becoming very, very important. But Dr. Dror Robinson was one of the first doctors in Israel to prescribe medical cannabis, and he's going to tell us a little bit about his history from the patient and the orthopedic point of view.
Okay, so thank you for the opportunity to visit Zurich, and I would like to start with an anecdote. How come I even became interested in cannabis? Because everybody knows that cannabis is only for pain. So I'm quite well known for developing cartilage transplantation about 30 years ago, and we have established a company, sold the company, or whatever, and so that's, most of my referrals are for cartilage work. And then comes in one of the most famous Israeli basketball players, and he says, I need some cartilage transplant, and I was told that you are the best, so please do it. And I'm looking at his MRI, and he has done 3 ACLs, and I see that one of his reconstructions is actually 90 degrees wrong, like the other side of the knee. I don't know how it happened, but the issue in my clinic is that people pay first and then they come in, so I have to, give him some good time. He paid. So I'm going to the other room and trying to discuss with the last guy who operated him, and I'm calling him and say, this guy, and said, don't touch him. I know all about it. Don't touch it. You cannot repair it. Okay. So I'm trying to think what to do with the guy. He already paid up, so I'm making some chit-chat and trying to decide what to say to him. And then his wife interjects and say, maybe cannabis will help him because he's so angry and nervous and there is some abuse and some issues in our marital life. And I said, okay, let's try it. And this guy actually became my biggest fan and went all over, and 3 months later, he came back and said, oh, you saved my marriage, you saved everything. And I see him on television, now he's a coach, and he's running around, and you cannot tell that his ACL is 90 degrees wrong. So maybe, so that's how I became convinced that cannabis works. And then I can tell you about my personal mother. And she's 92 years old, and she was beginning to deteriorate with dementia. And she belongs to the generations that built Israel. Israel was built through war, and she's been in all of them. And it's really breaking my heart to see her so. So I took her to one of our clinical studies. And she was scoring on a scoring system that says 30 is normal, and 15 is like sort of demented, strongly demented person. She was scoring 22, and it was 2 months ago. And now she's scoring, just yesterday, she did her last score. I was flying here, but she went to the hospital, and she's scoring 28. So it's just about normal, and she's 92, and it works. Okay, so cannabis works, and I'm a believer. But, so what's my experience? So, it has been approved for about 2 decades in Israel, so we have a lot of experience. And some of the indications are related to orthopedics. Some of the indications are a little bit orthopedics, like back pain, like arthritis, neuropathy, especially diabetic neuropathy, intractable pain, post-surgical intervention. And there is a big and hopefully stoned elephant in the room. We call it fibromyalgia. You can call it whatever you want. It's chronic pain. These people actually have a disease that is called chronic pain. It doesn't matter how it started. So what are the most common indications for me? It's probably low back pain, and then osteoarthritis. Those are the big ones. And there is a whole bunch of other indications. What are the other indications? Just about anything. Thoracic pain, CRPS, post-surgical, inflammatory arthritis, and so on. What's my personal experience? It's about 2,500 patients. The follow-up is between 1 and 8 years. And again, it's the same numbers. So it's mostly low back pain and osteoarthritis. And what are the effects? What happens is that according to Israeli law, we have to treat the patients for at least 1 year with opiates. So because of that, we have an opportunity to cross over the patients because I see them, I treat them, and then I cross them over to medical cannabis. So I have a standard therapy, what I give to these people, and then I have the data, and then I have a recommended standard therapy of cannabis. That's how we start up with sativa in the morning, and probably indica with quite a lot of THC in the evening. And I like smoking. I'm not sure that every medical treatment has to be a drug. I'm not totally sure, but we do not use tobacco. And those are our published results. So what are the effects? And please note that we also monitor the lumbar range of motion, which is important. It's not only pain. So what are the results? It's 46 patients followed for a minimum of 1 year. And as you can see, many of our patients do not receive the permit from the ministry, so we had some dropouts that did not receive the permit, but the people who did receive the permits were all treated for 1 year with opiates and atypical pain relief. And what's interesting is once they start treatments, they like to continue, so we did not have any dropouts. And those are the results. So we did monitor quality of life, which is slightly better, but it is significant. We did monitor the BPI severity, which is very much better because cannabis alters pain perception. And please notice the increased range of motion. This is an objective variable. So people actually move better using cannabis. And then we wanted to see what happens with diabetic neuropathy. I have a fairly large diabetic foot clinic as an orthopedic surgeon. And what happens to them? Again, we have to treat them for at least 1 year with different therapies. So I'm using tramadol, and I'm using Cymbalta or duloxetine, alpha-lipoic acid, and the vitamins. And we screened 89 patients with a minimal pain of 7. And this takes a year, so a lot of stuff can happen in a year. We had some dropouts. So we screened 89 and we actually treated 74. We had patients followed up for 1 year in 70 cases. Why did people drop out? One guy improved so much, he didn't want any more cannabis. One switched to oil and he dropped out from the study. And two did not come back to regular follow-up, so they did not continue their license. And those are the results. Once again, there is improvement of pain, there is improvement of quality of life, but please notice that standard therapy does not alter the hemoglobin A1C, which is a marker for the diabetic control. But on the other hand, what happens in a year? You have, of course, much better results in pain. You have much better results in quality of life. But what is more important is the improvement actually in again, the people who dropped out did not improve as much. It's another significant demonstration that cannabis works. We had complications, so these are difficult patients. They all have diabetic neuropathy. We had one case with ileus, which might or might not be related to the cannabis. We had a lot of patients with red eyes, which is not really significant, and so on. People sleep better, which you can write up as an adverse event, but actually it's an improvement. But this is the most important result for me. They started up with 12% hemoglobin A1C. They ended up with 8. This is huge. This is better than any of the new anti-diabetic medications on the market today. And what is the meaning of this improvement? You can say, oh, 8 is abnormal, 12 is abnormal, so what is the meaning? The meaning is like this. Those are the rates, the relative risk for complications at 12, and at 8, it's a completely different scale of relative risk. So it's a good indication why you need to give cannabis to these patients, at least in my opinion. Fibromyalgia. Again, there is a complication in Israel. It's not an indication for cannabis. You need a consensus of at least 2 doctors, a psychiatrist and a rheumatologist. And then we can only treat on a case-by-case basis only if they have low back pain, so we are kind of limited. And there is a question, what is the risk to give a psychoactive medication to somebody who is a little bit not completely balanced? Again, it's a crossover study. We had 31 patients. And once again, we can see a significant improvement, not only in the subjective variables, which are all what is commonly done in medical trials, but also in objective variables like the Schober test. So it's not only a body over mind, it's a combination. There is a bodily effect of cannabis. And we can prove it objectively, so it's important, especially in something like fibromyalgia, which is very subjective. And this is, for me, the most important part. What do patients say about the therapy? How does it compare to the standard therapy? So if you give patients standard therapy, it's all these blue bars, and they tend to say that they are either minimally worse or a lot worse by the standard therapy. But if you give them cannabis therapy, most of them will say they are very much improved or much improved. So patients are interested in getting cannabis therapy. This is important for all of the marketing people here and investors. And this is how it actually looks like. So the patients actually come back and say, thank you, doctor, for giving me this therapy. This is unusual. I never heard somebody I gave Cymbalta or Lyrica to tell me thank you. They never, okay, they come, they pay, everything is okay, they don't thank you. And this is the PGIC, it's very important marker of why therapy is important and why it works and why patients want it. So what are my recommendations? First of all, I think medical cannabis is safe and effective. I think opiate therapy should not be mandated as a one-year therapy, especially not for fibromyalgia. And the anti-diabetic effect of medical cannabis should be further explored. So thank you.